This is the Patient Assessment Medical Skills Evaluation. Your objective is to perform an assessment on a responsive medical patient to include a detailed history, vital signs, and a physical exam. The equipment you are authorized for this exam is a stethoscope, sphygmomanometer, a pen light, and a watch. Do you have any questions before we begin?
No.
Begin when you are ready.
The first thing I'm going to do is take the appropriate body substance isolation precautions. Next, I'm going to determine if my scene is safe. Is my scene safe?
Your scene is safe.
Now, I need to determine the mechanism of injury and nature of illness. What is the injury and illness?
The nature of illness is non-life-threatening, and he has no mechanism of injury.
Is this my only patient?
This is your only patient.
I've determined that no additional EMS assistance is necessary. Since my patient is responsive and does not have a mechanism of injury, that would lead me to believe that there is no spinal injury, so I will not take spinal precautions. My patient is a young adult male who appears to be in distress. Sir, how are you doing today?
Not too well.
Can you tell me your name?
Matthew Jones,
Can you tell me where you are?
the health clinic,
Can you tell me today's date?
October 13th.
So my patient is A&O times 3. What seems to be bothering you today?
My head hurts and I'm feeling nauseous.
My patient's chief complaint is that he has pain in his head coupled with nausea. At this point, I'm going to assess my patient's ABCs, his airway, breathing, and circulation. It's obvious that my patient is breathing and that he has an open airway because he is talking to me in a normal rhythm, and from where I'm standing, I can see his chest rise and fall. So now, I'm going to check my patient's pulse and assess his skin. Does my patient have a pulse, and is his skin warm and dry to the touch?
Your patient has a regular radial pulse with warm and dry skin.
I've determined that this is a low priority patient and he can be treated here in place. Next, I'm going to determine the history of the present illness by investigating the signs and symptoms using the mnemonic OPQRST, which stands for onset, provocation, quality, radiation, severity, and time. Sir, can you tell me when you started feeling this pain?
Today?
Does anything make it better or worse?
No.
Can you describe the quality of the pain? Is it sharp, dull, throbbing?
It's a dull pain.
Does the pain radiate?
No.
On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you have ever felt, how would you rate your pain?
A 3.
Does the pain seem to get better or worse at different times in the day?
No.
Do you have any allergies?
No, I do not.
Are you taking any medication?
No.
Do you have any past pertinent medical history?
No.
What was the last thing you ate or drank, and when?
A glass of water this morning.
What were you doing before you started feeling this pain?
I was sleeping.
Now I'm going to move on to my focused physical assessment. I'm going to start by assessing my patient's neurological system. Sir, do you have a history of any neurological ailments?
No.
Do you have a history of any head trauma?
No.
Using my pen light, I'm going to assess my patient's pupils to see that they are equal, round, and reactive to light. I'm also going to check his extraocular movement. Can you follow my pen with your eyes? Good. Can you wiggle your fingers for me? Can you feel me touching you?
Yes.
Now can you wiggle your toes? Okay. I'm going to tap your knee here. Next, I'm going to assess my patient's cardiovascular and pulmonary systems. Sir, do you have a history of any cardiac ailments?
No.
Have you been experiencing any chest pain?
No.
Do you have a history of any respiratory illness?
No.
Have you been experiencing shortness of breath?
No.
I'm going to take a listen to your heart and lungs.
Okay.
Take some deep breaths. During my assessment, I was looking for any signs of jugular vein distension. Next, I'm going to assess my patient's gastrointestinal and genitourinary system. Sir, do you have any history of any bowel or bladder ailments?
No.
Have you been having normal bowel movements?
Yes.
Have you been having normal bladder movements?
Yes.
Okay. I'm going to have you lay down. I'm going to assess your abdomen.
Okay.
I'm going to listen to your bowel sounds. Now I'm going to feel your abdomen. Let me know if you feel any pain or tenderness.
Okay.
Okay, you can sit up now. Now I'm going to assess my patient's musculoskeletal and integumentary system. Sir, do you have a history of any musculoskeletal injuries?
No.
Do you have a history of any skin ailments?
No.
Can you squeeze my fingers as tight as you can? Press down on my hands. Press up. Push out. And push in. Can you press down on my hands? Press up. Push out. Push in. During my assessment, I was assessing his limbs for any deformities and his skin for any abnormalities. Now, I'm going to ask my patient some questions to assess his psychological state. Sir, do you have a history of any psychological illness?
No.
Have you been experiencing any added stress at home?
No.
Have you been experiencing any added stress at work?
No.
Now, I'm going to obtain a set of baseline vital signs to include blood pressure, pulse, and respirations. My field impression of my patient is that he is a young adult male who presents with 3 out of 10 pain in his head and nausea. He is not currently taking any medication, and based on my physical exam and the history I've gathered, his pain is not likely trauma-related. My impression is that he has a headache with mild nausea. At this point, I would reassess any interventions I've made, recheck vital signs every 15 minutes, check for any changes in my patient's status, and provide report to the next echelon of care.
Congratulations, this concludes your patient assessment medical skills evaluation.